Good morning, I'm Christine A. Robles, your reporter for today. My report was all about typology of learners with special needs. Learners with physical disabilities. First, what is physical disabilities? Students with physical disabilities may have problems related to movements, posture, grasping or manipulating objects, communication, eating, perception, reflex movements, and or automatic motricity. Number 1, visual impairment. What is visual impairment? Visual impairment is a term experts use to describe any kind of vision loss, whether it's someone who cannot see at all or someone who has partial vision loss, and not be able to see objects at a distance like a whiteboard or blackboard. As you can see in this picture, this is the example of visual impairment. What are the 3 main categories of visual impairment? We have mild, moderate, severe, and blindness. Mild is a visual activity worse than 6/12 to 6/18. Moderate is a visual activity worse than 6/18 to 6/16. Severe visual activity worse than 6/60 to 3/60. And blindness is a visual activity worse than 3/60. What is the most common visual impairment? Cataract is a clouding of the eye's lens and is the leading cause of blindness worldwide and the leading cause of vision loss in the US. So now, let's proceed to the hearing impairment. Impairment is defined by IDEA as an impairment in hearing, whether permanent or fluctuating, that adversely affects a child's educational performance. Types of hearing impairment. There are 3 types of hearing loss: Ciceronian hearing loss, conductive hearing loss, and mixed hearing loss.
There are 4 factors of hearing impairment: noise exposure, health conditions, certain medications, and genetic factors. The most common type of hearing loss. Sensorineural hearing loss is the most common type of hearing loss. It is a permanent hearing loss that occurs when there is damage to either tiny hair like cells of the inner ear. So, the example of sensorineural hearing loss is sensorineural hearing loss, or SNHL, happens after inner ear damage. What is the speech impairment? Speech impairment are disorders of speech, sounds, fluency, or voice that interfere with communication, adversely affect performance and fluctuating in the educational environment, and result in the need for exceptional student education. Example of speech impairment. Some common speech impediments are stuttering. This condition might indicate developmental delay, an inherited condition, or a sign your child's brain isn't coordinating the function that drives speech. Articulation errors. The symptoms of a speech disorder are repeating sounds, which is most often seen in people who stutter, adding extra sounds and words, elongating words, making jerky movements while talking, usually involving the head, blinking several times while talking, and visible frustration when trying to communicate. Let's proceed on what is speech impairment in communication. Speech or language impairment means a communication disorder such as stuttering, impaired articulation, a language impairment, or a voice impairment that adversely affect a child's educational performance. There are 3 general categories of speech impairment. First, fluency disorder. This type can be described as unusual repetition of sounds or rhythm. Second, voice disorder. A voice disorder means you have an atypical tone of voice. Third, articulation disorder. If you have an articulation disorder, you might distort certain sounds. The fourth type of learners with physical impairment is multiple physical impairment. Having multiple disabilities means that a person has more than one disability. What are the characteristics of multiple physical impairment? These physical and medical problems results in the presence of two or more of the following characteristics: restriction of movement, skeletal deformities, sensory disorders, seizure disorders, lungs and breathing control, or other medical problems related to these characteristics, such as skin breakdown or bladder. We have types of multiple physical disability. Some examples of multiple disabilities are deaf-blind, visual impairment plus hearing impairment plus mental retardation, visual impairment plus mental retardation, cerebral palsy plus mental retardation, hearing, speech, visual problems. Here are the causes of physical impairment. A person can acquire physical disability due to a number of reasons. These can be severe accidents, brain injuries, infections, diseases, and as a side effect of disorders and other medical conditions such as a stroke and dementia. The federal definition of multiple disabilities gives two examples of possible combination of disabilities. First, intellectual disability and blindness, and intellectual disability and orthopedic impairment. Again, the four disabilities that learners have in physical impairments are virtual impairment, speech impairment, hearing impairment, and multiple physical impairment. This is all, and I hope you have learned something. Thank you for watching and listening.